Okay, this is now, we're going to do chapter 1 from this book, Medical Reformation, Vegan Renaissance Bible. Okay, chapter 1 is called Why Medical Reformation, Why Now? 25 Theses. Okay, and this is reminiscent of Martin Luther when he posted the 95 Theses on the church door in Wittenberg in Germany back in 1517, which was thought to be, was considered the beginning of the Protestant Reformation. Okay, so thesis number 1. Why do internists treat atherosclerosis with pills which have a 0% cure rate when low-fat vegan, LFV, with no oils, also known as the Esselstyn diet, has a 99% cure rate? Okay, and actually if people follow the diet, it's probably even better than that. Okay, so why would doctors and patients choose a treatment method which never cures the patient and avoid, there's another option that almost always cures the patient? So why would they choose the wrong option? I'm sure it has nothing to do with money. And it's also true, you know, that a lot of people, most people in my experience, are lazy and stupid, and you offer them a cure, and they will say to you, because I've had people say this to me in just the last 5 days, oh, I can't give up eating meat, oh, I can't do that, you know, you'd have to be a robot to do that. They just don't sort of see it as being possible. And it kind of reminded me of, imagine somebody said to you, can you walk on water? And the first thing you say, oh, no, I can't walk on water. Only Jesus could walk on water. You know, St. Peter tried and he couldn't do it. No one could walk on water. And everybody knows that. That's obvious. But you think about it a little bit more, and no, it's not. It's completely obvious that everybody could walk on water quite easily. All it has to do is be frozen, okay? And then anybody can ice skate on it and walk on it. It's not a big deal. So I'm kind of joking, but what's my point? Is all you have to do is look at epidemiology, and every illiterate moron that eats a plant-based diet in these old traditional communities, they're all fine. They don't have any coronary artery disease, obesity, diabetes, none of this stuff. So all you have to do is figure out who is successful and can I imitate them? I mean, it's not rocket science. Okay, thesis number 2. Why do cardiologists treat coronary artery disease with stents, which has a near 0% cure rate? Except for during an acute heart attack. It's going to be very useful to have them open up a coronary artery during an acute heart attack. When low-fat vegan with no oils has about 99% cure rate for chronic coronary artery disease, CAD. Why do surgeons treat chronic coronary artery disease with open heart surgery, which also has a near 0% cure rate? When again, LFV, low-fat vegan, 99% cure rate. So it kind of goes back to the whole structure of the healthcare system. Basically, the assumption is always made for standard of care. Everything goes by standard of care. And the majority of medical patients are cognitively slow, okay? The people watching these videos, you're intelligent people, you're seeking out knowledge and information. You're not the average patient in a hospital. The average patient in a hospital, you know, they're hypertensive, diabetic, older. Quite often they're alcoholics, drug addicts. They've had multiple small silent strokes before, cigarette smokers. And you would say, well, why is it that way? And it's because people who do those things are sick all the time, okay? And it's also true that stupid people get sick a lot more than smart people because they always do stupid things. And then the doctor's not paid for talking to them. Doctor's paid, give them a drug, do a surgery, okay? That's where the money comes from. So once again, you know, and Esselstyn had pointed this out, the most common cause of death in the Western world is coronary artery disease and heart attacks. And they can also lead to arrhythmias and stuff. And they're essentially not treated. You got these, you know, nonsense treatments, drugs, surgery, and stents that don't work. I mean, you can open up a blockage and relieve chest pain on exertion. So you can decrease cardiac anginal pain. But you're not changing all-cause mortality because you're not treating all the small vessels that go into the cardiac muscle, the intramyocardial branches, for example, or the more distal even epicardial branches. Okay. Thesis number 3. Most cardiologists, cardiac surgeons, vascular surgeons don't even know that atherosclerosis is a blood clot. That bridging molecules overcome the zeta potential. That hemorrheology and atherothrombosis theory explain atherosclerosis. That circulating endothelial precursor cells form a neointima. This is like a basketball player not knowing how to dribble. I can tell you, I did a fellowship at Harvard with an emphasis on vascular disease, all right, imaging guided surgery, which is also called interventional radiology. And every week I went to vascular conference, and I'm in there with cardiologists, and I'm in there with vascular surgeons, some of the best vascular surgeons in the world, okay? Never once did it ever come up that atherosclerosis is a blood clot. And I don't recall ever discussing diet in these conferences, not once. And of course, that was a long time ago. You know, that was back in the 1990s when I did my fellowship at Harvard in interventional radiology with an emphasis on vascular disease. Okay, we did a lot of balloon angioplasty, stenting, thrombolysis, and all that stuff, transcatheter. All right, and I know, I'm not going to say any names, but I know some of the most famous researchers in the world doing research on things like pulmonary emboli, treatment of diabetes, prevention of atherosclerosis. And I can tell you, even now, if you go over to Brigham and Women's Hospital, they're doing a lot of work, and they're sort of claiming that atherosclerosis is largely due to a combination of elevated cholesterol, which is true, that's known, and due to inflammation. I think this idea of it being due to inflammation is kind of bogus because Esselstyn easily reversed it with a low-fat diet. And it's also true a high-fat animal food diet causes some inflammation. But what I'm saying is, just because you elevate CRP in the blood, that doesn't mean that you specifically have inflammation. It could also be functioning as a myokine due to depletion of muscle glycogen. So anyways, we're not going to get into that much, but this idea of saying it's due to inflammation just provides an excuse to give another drug. Whereas you're not even talking about the fact that you can put them on a low-fat vegan and just cure them if they're willing to follow it. Okay, number 4. And by the way, very few doctors know it's a blood clot. Once you understand atherosclerosis is a blood clot, all of a sudden you can start connecting all kinds of things that before you just couldn't put it together. Like, why can a 15-year-old with sickle cell anemia have a myocardial infarction? Because it's a blood clot. Okay. Okay, number 4. Thesis number 4. Why do doctors treat type 2 diabetes with pills that have a 0% cure rate when it can usually be cured with low-fat vegan diet? How come the average endocrinologist has not read the basic introductory papers about diabetes causation, like those by Sweeney, Himsworth, Rabinowitz, Brownlee, and Shulman? How can they treat diabetic patients when they know so little about the disease? The typical American healthcare provider thinks that diabetes is a carbohydrate disease. But anyone who's read the landmark papers knows that insulin resistance is caused primarily by high-fat diets. If you're doing research with animals and you want to give them atherosclerosis, you feed them eggs. If you want to give them diabetes, you feed them a high-fat diet, like especially saturated fat. Populations eating low-fat plant-based diets almost never get type 2 diabetes, and this has been known since the 1920s. Conventional medicine is ignorant of this and thus functionally illiterate. So functional illiterate is somebody who knows how to read but doesn't read. Okay, and I can tell you, I have some friends, and I asked them who's the best diabetes doctor in the city, and, I went and met with some university endocrinologists, and I wanted to talk to them. I was interested in understanding diabetes because I was interested in understanding what causes dementia, and I was trying to work out some subtle, nuanced, complex aspects of it, okay? So when I went to meet with these endocrinologists, I'm like, well, what do you think of this paper, Sweeney paper, Himsworth paper, Rabinowitz paper, Brownlee paper, Shumley paper, Taylor paper? They're like, oh, we haven't read those. And I'm like, these are all the basic papers of diabetes. They haven't read any of them, okay? So how could they be treating diabetic patients? Because they know the drugs. They know exactly what drug to prescribe in all these different situations, but they really have no clue about what causes the disease. And I actually was invited at one place to speak to the fellows, but then once I was conversing some more with the endocrinologists, they were embarrassed because I know so much more about diabetes than they did. And that's what I used to think when I was young, you have to send the patient to the specialist because the specialist is going to know a lot more about their specialty condition. But what I've learned now is, nah. Boards exams are based on what's in the conventional textbooks, and the conventional textbooks say the same thing just about for almost every chapter, including diabetes. Nobody knows what causes it, increased incidence with aging, take these pills to slow it down, okay? It's partly genetic, all right? So that's why anybody just as curious can learn these diseases quite often more rapidly than somebody who's done a fellowship in the subject. That sounds bizarre, but it's actually true. Okay, why do doctors treat hypertension with pills that have a 0% cure rate. And I say they have a 0% cure rate because the patient has to keep taking the pills every day for the rest of their life. Versus a cure rate means that you don't have to take a pill or anything or need a surgery or anything. That's a cure, all right? When usually you can cure with a low-fat vegan. And by the way, low-fat vegan is a pleasant diet. I've eaten it for many years, and I like it. And lots of people have eaten low-fat vegan. They're very happy with it. It's easily sustainable for the rest of a person's life. Okay, continuing with thesis number 5. How come medical students are not taught that high-fat, high-sodium diets cause hypertension and that plants prevent it? High-fat diets cause hypertension because the fat sticks the red blood cells together into a rouleau formation. That means like a stack of coins in French, or into blood sludge, if you will. You know, like LDL cholesterol sticks RBCs together. Chylomicrons will stick RBCs together. Sodium inhibits endothelial nitric oxide production, endothelial nitric oxide synthase. So you get vasoconstriction. Instead of the artery being open, it clamps down. And then you have to pump the blood through a narrowed system, so pressure has to go up. When the RBCs are stuck together because of the high-fat meals, then you're pumping a milkshake, thick blood, instead of thin blood that's like water, so pressure has to go up. And what's the point of blood pressure? To get blood to the top of your brain. That's the hardest spot against gravity to pump to. So if you're pumping thick blood, a milkshake instead of water, pressure has to go up. If the system's all constricted, the vessels are narrow, in order to get the same amount of oxygen delivered to that brain tissue, you have to pump at a higher pressure. Plants provide all the good stuff that you want. They provide potassium, magnesium, which are like vasodilators, opening up arteries, and the nitrates that are the precursors to make nitric oxide in a systemic basis. Potassium and magnesium, like I said, are vasodilators. Nitric oxide is a vasodilator. They also provide antioxidants, which help prevent something called oxidative stress we'll talk about later. Pathology books will tell you that 95% of hypertension is essential or of unknown cause. And I can tell you, they still say that to this day. 90 to 95% is unknown cause, which is completely ridiculous, okay? It's not true. It's demonstrably, obviously not true. Okay, epidemiology and vegan nutrition books will tell you that plant-based populations almost never get hypertension. They've got about the same blood pressure for their entire life. And that's partly why I started to write this book. Because what happened with me now is, I'm an old guy. I'm 60 years old. My kids are grown up. My wife works. I'm bored. I sit there by myself and I start going through these books, okay? And I'm like, holy crap, these books are wrong. They're wrong almost every single chapter. And it's not just the internal medicine books, the neurology books, they're a joke. The biochemistry books, they're a joke. It's almost as if, somebody decided they're going to make sure all the books that are used by medical students, internal medicine residents, and other internal medicine related fellowships contain almost no useful information. And I say that being surprised. Okay, like I said, I was shocked in my 30s when I got fat and my parents were sick that I couldn't find the answers to help them or myself in these medical books. And now going back to them, I fully understand how ridiculous these books are. Thesis number 6. How come surgeons often don't know the most basic stuff, like blood flow is improved by a low-fat, low-sodium, whole food, plant-based diet? Okay, making a spoof on Proverbs in the Bible. Fear of ischemia is the beginning of health wisdom. Okay, like a lack of dietary fiber leads to leaky gut and abdominal pressure syndrome. How come vascular surgeons do not teach their patients about low-fat vegan diet to prevent atherosclerosis? Isn't it obvious? Meat contains the bad stuff like excessive saturated fat, excessive protein, excessive iron. All these things cause atherosclerosis and activate mTOR. Plants contain the good stuff, like fiber, potassium, magnesium, nitrates, and antioxidants. These are what people are deficient in: fiber, potassium, magnesium, and nitrates, because they don't eat plant foods. Okay? And like I said, people used to say, oh, the vascular surgeon, cardiothoracic surgeon, they're the experts on, and the cardiologists are the experts in atherosclerosis. What I would say is, no, they're not. They're a bunch of plumbers. Their job is to figure out how to open up a stenosis, a narrowing. They don't know hardly anything about atherosclerosis. The pathologists who research it put a microscope on it. They go, hey, it's a blood clot. Okay, how come medical schools do not teach nutrition, toxicology, and this is thesis number 7. How come medical schools do not teach nutrition, toxicology, and epidemiology, even though those are the most important topics for improving health? So it's like a mnemonic I use is NET. N for nutrition, E for epidemiology, and T for toxicology. Biochemistry books routinely recommend high-fat diets like the Mediterranean diet. And that's like treating a lung cancer patient with cigarettes. That's like sending a syphilis patient to a brothel for treatment. It's completely stupid. I mean, it's so stupid, it's the opposite of what is correct. And I can tell you all the medical conferences, that I've seen for treatment of obesity, bariatric surgery, and all this stuff, and weight loss, they all recommend the Mediterranean diet, which is completely stupid. It doesn't help the patient. Oh, I wrote it down here. The Mediterranean diet is the Antichrist diet because it promises salvation, but it leads them instead to hell. Okay, continuing on. Biochemistry books, they almost never talk about anything that sort of criticizes a popular commercial processed food. It's like, why am I reading, chapters of glucose metabolism without mentioning the obvious fact that fluoride is a major inhibitor of glycolysis and also inhibits parts of Krebs cycle and of electron transport and oxidative phosphorylation in the mitochondria inner membrane. So it inhibits like all the three major parts of glucose metabolism. Why isn't that in the books? Why don't medical students know that? Okay, aluminum is damaging to mitochondrial function, so is mercury, chlorine. Sodium is a little more complex. We'll talk about that later. But all these things are common toxins. Manufactured-free glutamate, aspartame, stevia, increasing risk of infertility. The problems with all these estrogenic chemicals. So what I'm basically saying is, I have a lot of experience talking to medical students, and I can tell you this: they never know anything about the common diseases. So, even somebody who's finished 4 years of pre-med in college, 4 years of medical school, and even when they're senior residents, they don't know any of this stuff. Okay. And like I said, too, I got friends that are, they've been internal medicine doctors 20, 30 years or more, and they don't know this basic stuff because it's not in their literature. And to me, like I said, it's ridiculous. It'd be like a basketball player not knowing how to dribble, okay? It'd be like a baseball player not knowing how to pitch and catch. I mean, it's like basic, foundational. Surgeons that don't know how to improve blood flow. How are you going to heal a wound if you don't know how to improve blood flow? This stuff should be taught, the first year of med school. It's cognitively very simple to learn. But what I've said happens is medical students are essentially taught learned helplessness, that it's impossible to cure a chronic disease like hypertension, diabetes, atherosclerosis, autoimmune disease. And this is intentional, conditioned, learned helplessness, like a severely chronically depressed person. And the motto of allopathic medical schools is, we are the best. We never cure anyone of chronic disease. We always lose, but we're the best. What would you think of a sports team that brags about losing every game? So what they say with a chronic disease patient is, we always lose. We always fail to cure the patient. It's impossible to cure these patients. You look at the low-fat vegan websites, they cure these patients every day easily, routinely. How come medical schools don't teach that religious people are a lot healthier? Okay, there's animosity towards religion. There's this attitude of, we only need, science, atheistic, Darwinistic science. Okay, and that reminds me a lot of Stalin. All right, that's not, what people want. Religion is the friend of the poor people. The two big friends of the poor people are religion and free speech. Okay, they don't have any money. They can't pay for anything or buy anything, but being able to speak a true opinion and also having the religion, those are things that empower them, okay? And remember what religion means, like in Latin, religare, legare, to ligate, to tie together, to tie a people together. And it's that sense of we're all in this together, helping each other, that empowers the poor people. And that's also why rulers, they don't want the poor people to have a religion or to have a God other than the ruler themselves, because they want to take their power away, okay? All right, thesis number 8. Why do doctors treat autoimmune disease with powerful pills similar to chemotherapy that have a 0% cure rate, when it can often be cured by low-fat vegan and other things to prevent leaky gut, preventing leaky gut? All these things that are like processed food like GP, F-, aluminum. Ivy League pathology books do not even mention leaky gut. Okay, how ridiculous is that? The most common cause of autoimmune disease. And it's not even mentioned in the book. But then they'll mention all these powerful drugs that are like, cancer chemotherapy to treat them. Ridiculous. All right, medical students graduate from without ever having heard of leaky gut. I was amazed the first time I had this, because I always like to ask medical students questions, as a way of teaching. You can call it the Socratic method of teaching. And I've learned from experience, they all say exactly the same thing. And the reason is they're all trained exactly the same way. Medicine rewards respect for the hierarchy, and it rewards conformity. It does not reward thinking. It does not reward reading on one's own. They keep them so busy, they don't have time to read on their own. So I can tell them, when I ask them all the standard questions about common Western disease, they don't know the answers to any of them. They'll get 100 out of 100 wrong, and that's why they can't cure any of these diseases. Okay, number 9. Why do medical centers, including many doctors in the Ivy League hospitals, recommend Mediterranean diet? I'm going to abbreviate that, MDT, for treatment of obesity and other health conditions. It's stupid. It almost doesn't forbid anything. Mediterranean diet is what a phony person says when they want to pretend they know what they're talking about, that they're an expert. But really, when they say Mediterranean diet, you know that they're a phony, because it's nonsense. Okay, it allows alcohol, caffeine, dairy, meat, oils, high-fat plant foods like nuts and seeds. Just stupid. Okay, anybody who studied nutrition knows that Mediterranean diet is a big joke. And it gets recommended to a lot of people. You have patients like these pro football players with cognitive impairment, CTE, chronic traumatic encephalopathy, and they're recommending Mediterranean diet to them. How stupid is that? That's also why I laugh, because some people think, oh, Harvard or Yale or these other Ivy League schools, oh, the people over there, the doctors are so smart, they must know what they're talking about. No, they're all the same. All the medical places are the same. There's really not a dime's bit of difference between the big shot places and the small places, okay? I've worked at all these types of places. And the big shot places, they just drug the crap out of people, okay? Don't get me wrong. The students might have had better test scores to get in a lot of their residency programs, but that really doesn't translate into hardly any effect. Okay. Okay, I gotta make my picture a little smaller here. Okay, why does adult psychiatry prescribe drugs that hardly ever cure anyone, but have lots of side effects? Dr. Bragan, Harvard psychiatrist, says that almost all psychiatric drugs basically cause a slowly progressive lobotomy. And so he wrote a very good book about that. He's written a bunch of books, but the best one was where he emphasizes the pharmacology. And I would actually say the medical doctor degree in allopathic medicine, they maybe should change it to therapeutic pharmacology, because they really don't know medicine. All they really know is how to prescribe drugs. Grace Jackson, they know more than that. And they have a good foundation. So basically, once a doctor, the light bulb goes on in their brain, gee, I want to learn, and now this is where the information is, nutrition, epidemiology, toxicology. They can start learning quick, okay? And they're still stuck with the dilemma. They don't get paid for teaching the patients this, but at least they'll be able to give proper information. And for the few rare patients, that are willing to learn and listen, they might be able to really help them. Okay, so that's a rather extraordinary book, Grace Jackson's book too, on how psychiatric drugs cause dementia. She basically says, that she says the exact same thing as Bragan, and they're not the only ones. There's other psychiatrists too, but they're the ones that most directly say psychiatric drugs are designed to cause, well, not intentionally, but the way they work, they cause a lobotomy, a chemical lobotomy effect. Okay? And, patients aren't told that you've got other options. There's such a thing as food and mood having a big effect on food. Okay? There's such a thing as all the benefits of exercise and sleep and whatnot. And there's also the consolation of religion, the consolation of having a strong purpose in life to enable you to endure all the sad things that you must endure. Okay, thesis number 11. Why do urologists operate on so many prostate cancers when the Dean Ornish research study has shown that these patients have a good chance to get a better outcome with a plant-based diet? We'll call it the Ornish diet and stress management. I always tell people Ornish rhymes with Cornish because they'll remember that. Cornish hen if they want to go look it up themselves. So yeah, the patients that, it was about, I forget the exact number, something like 98 or something, a bunch of biopsy-proven prostate cancers that decided not to have radiation or surgery. They went on a vegetarian diet and they did a little bit of walking or something, or stress management or meditation or some other stuff like that, but they kept their PSAs the same or reduced them, versus the patients that went, watchful waiting, same old diet and whatnot. They tended to elevate their PSAs and have to be recommended to go on to surgery or radiation. Okay, so the old joke is, what's the purpose of a prostate? to help a urologist make money. And the prostate is like the female uterus in terms of it being sensitive to estrogenic chemicals. So the same diet that's packed with estrogenic chemicals that are making people infertile, that are making people fat, that are increasing their risk of diabetes and autoimmune disease, are also increasing a man's risk of benign prostatic hypertrophy, BPH. Okay, thesis number 12. Why do nephrologists know so little about nutrition? How come they are not coaching their patients to eat a low-fat, low-sodium, low-protein diet, like the Kempner diet, the Kempner rice diet, that can so often improve the function of the kidneys? What do kidneys mostly do? The main thing the kidney does is it excretes nitrogen. There's no nitrogen in carbohydrates and fats, okay? So they're relatively clean burning fuels in comparison, especially carbohydrates. But in comparison, protein's got all this nitrogen, and we can't store it long term, so it has to be excreted by the kidneys. And so the more amino acids you eat, the more protein you eat, the more work you're creating for your kidneys. And also, if you eat a meat diet, it causes all kinds of nonspecific inflammation that adds to the workload of the kidneys. So it's also acidic, and the kidneys excrete excess acid from the body. So you're putting a big, hat trick, triple whammy of extra work on your kidneys. More protein, more inflammation, and more acid. Okay, of the macronutrients, only protein has nitrogen. And so by reducing your dietary protein, you give your kidneys a vacation. That makes life a lot easier for them. And I'm saying anybody could know this. But you will not hear this often spoken to patients. If you talk to kidney failure patients, people with mild kidney failure. I've never met one that ever said this to me. I've talked to a lot of them. Okay, we'll keep going here. Why do pediatric psychiatry programs prescribe amphetamines to children when it's illegal to sell amphetamines to an adult on a street corner? These drugs put these children at high risk for brain damage and high risk for becoming chronic psychiatric patients. This is poisoning patients. Thomas Schaus said this, the psychiatrist, back in the 1960s. And I'm sure this has nothing to do with putting profits over people. Friends, Romans, countrymen, lend me your ears. I come to bury children, not to praise them. The noble psychiatrists have told you that amphetamines are good for children, and these psychiatrists are honorable men. You all did love children once, and not without cause. What cause withholds you then to mourn for them? O judgment, thou art fled to brutish beasts, and men have lost their reason. Bear with me. My heart is in the coffin with these children, and I must pause till it come back to me. Okay, so that, of course, is a parody of Mark Antony's speech about Julius Caesar in the play Julius Caesar by Shakespeare. And so what I'm saying is, how much more obvious could this be? Okay? These doctors are paid to poison children. Okay? And nobody does anything about it. Everybody's like, oh, okay, well, what are you going to do, No, it's wrong, okay? It's incredibly wrong. And how does it happen? Because they're at these Ivy League or other fancy big-name places, and they want to get promoted. They're promoted based on the number of papers they write, how much grant money they can generate for the university medical center. So Big Pharma says, Big Pharma's got the money. Big Pharma says, look, you want money? Make us look good. Make our drug look good. Help us to sell more drugs. So they help Big Pharma sell more drugs. Then they get grant money. Their research doctor at the big name place is happy. Big Pharma's happy. The University Medical Centers gets all these extra patients, runs some money through their pharmacy. They're happy. Everybody's happy, but the patient's screwed. Okay? Why do pediatricians give toxic drugs to children that do more harm than good? Okay? Look at some of the baby formulas, all the crap that's in them. Okay? And a lot of these other medicines, there's a lot of side effects. Look at Tylenol. It's toxic to the liver. That gets given in tremendously large amounts to kids, etc., etc., etc. Okay, why do cancer doctors often give chemotherapy even when they know the patient is unlikely to benefit? Why do they just assume that the patient's already practically dead, so they might as well try the latest drug in fashion? And I can tell you that is a common way of thinking in medicine, is that, look, the patient's got cancer, metastatic, they're going to die anyways pretty soon. Why don't we just give it a try? Maybe it'll work. And it is true, maybe it will work. But you're going to put the patient in a lot of side effects, and unless you've got good reason to believe it's probably going to work, why put the patient through the side effects? The side effects are, pretty high certainty that they're going to occur, so why do that? And I can tell you, it's sort of like, most patients with cancer, in my experience, they go to the cancer doctor and they say, please save me, okay? It doesn't even occur to them that they should do all these things to help themselves. Thesis number 16, why is it that so many long-term survivors of cancer say that the key was to become a low-fat vegan, to sleep more and exercise more and be more Christian? Okay, you're going to see that, all right? I think I'm going to divide this chapter into two parts because it's kind of a long chapter, so we'll call that the end of part 1, and in a moment, I'll go ahead and do a part 2 of this chapter 1.